No woman should die while giving birth. Nevertheless, every day 20 women died during pregnancy and childbirth in Uganda. Midwives can save many of these lives through antenatal care services before delivery, through qualified assistance during childbirth, and through care, treatment, and counseling after birth. In fact, it is estimated that trained midwives could help prevent 2 out of 3 maternal and newborn deaths.
The midwives do what we call the antenatal care. These are the visits which a mother, pregnant mother, makes with the midwives, focused completely on finding out what is the problem with the mother, whether she has any problem, whether she has any illnesses. And the midwives are able to treat most of the pregnancy-related conditions because in their training, they are trained to do that.
To create human life, we put the lives of our mothers, wives, sisters, and daughters in the hands of midwives. This makes midwifery one of the most important professions in the world, and therefore makes midwives our unsung heroes. In 1751, the Collegium Medicum reported to the Swedish Parliament that of the 651 cases of women who had died during childbirth, 400 could have been saved if they had had access to a midwife. Midwives were trained in safe delivery techniques, including infection prevention, and a century later the mortality rate per 100,000 births had decreased to 230 from 900. Today, Sweden's maternal mortality rate stands at 4 deaths per 100,000 live births. It is in recognition of the fundamental role of midwives in maternal and neonatal health that the Swedish Ministry for Foreign Affairs has launched the global awareness initiative Midwives4ll. The Embassy of Sweden in Uganda has launched the initiative to highlight the important role of midwifery.
With this campaign, we hope to influence policymakers, mobilize communities and attract young people to the midwifery profession. In doing so, we want to highlight 2 key areas that have the potential to improve maternal health in the country. First of all, we hope to attract more young people to the midwifery profession and make midwifery their career of choice. Secondly, we want to engage men to take shared responsibility for maternal health. One way of doing so is to ensure that their wives, daughters and sisters deliver safely with the assistance of a trained midwife.
Every year, about 1.6 million babies are born in Uganda. That is more than 4,000 babies every day. Only 57% of these babies are born in a health facility with the assistance of a trained health worker. The rest are born outside health facilities, exposing both the babies and their mothers to serious complications during and after birth. Complications which too often lead to their death.
Most of the children who are born in the rural areas mostly die because of no enough attendance. So, and another problem is the network. The communication is poor to access the rural areas, like transport.
Lack of qualified midwives is a significant contributor to the high rate of mothers who die giving birth, especially in the hard-to-reach areas. There are simply too few midwives to assist an increasing number of pregnant women who go to health facilities for help.
One midwife should be delivering 175 women per year. Right now, our midwives are delivering twice or thrice that number. So that means we need 2 or 3 times more midwives to be able to deliver what the World Health Organization recommends.
Midwives in Uganda work under extremely difficult conditions, especially in public health service centers and hospitals. They work day and night to save the lives of mothers and their babies, often in poorly equipped facilities.
Our maternal-mortality ratio remains high, although it has been declining over time. But today we estimate it to be about 438 deaths per 100,000 live births. And by any standards, this is high. And as Ministry of Health, we are concerned and we are working very hard to make sure that we bring down this maternal mortality.
It is therefore imperative that we support midwives to do their work. First of all, we must encourage more young people to join the profession so that all women in Uganda can have access to a midwife when they need one.
When I used to go in the nearest health centers in my home district in Tungamo, I used to admire midwives, the way they receive young babies. They receive life, new life, as in you deliver, I see someone delivering. I know one day I expected my mother, she was going to deliver her last born, and I was inspired. I saw a midwife receiving a new baby. I was like, I would be like this in the future.
One of the critical courses we should be promoting is midwifery, but very many of them are not aware of the course. They are not aware of the many roles and the need in the country. And also maybe because, you know, it's one of the, I think probably the only medical course which deals with two people, the mother and the baby. Most times other medical fields deal with the patient alone, one patient. But in midwifery, you're handling two, a mother and a baby. So when there is any misfortune, it's usually gross. And because of that, I think there is a bit of a fear, there's a bit of misunderstanding about midwifery, but it's a career that should be promoted and young people should be encouraged to take it up.
We should ask them or help them to take that as a profession, to take it as a calling, as a vocation, but not as a job seeking. They shouldn't go there to seek for jobs. If they go as if they are only seeking for jobs, they may not give that care that is needed to protect life.
Most maternal deaths are preventable if skilled care before, during, and after childbirth is available.
Our population is outgrowing the staffs that are recruited in the hospitals. Not only Mulago where I'm working, but even down up to the health centers, those ones in the villages. You can get only one midwife or two midwives who are to work sometimes all the 3 shifts. That is day duty, evening duty, and night. One staff, and it is a challenge.
To improve maternal health, women must demand for and make use of midwifery services. In addition, men need to be engaged in safe delivery. Men must also support and encourage their mothers, sisters, daughters, and wives to go for antenatal care and to deliver in a health facility.
You should be involved right from the time I conceive to the time the 9 months come to an end. You should be involved. To the time I get into the labor ward, you should be right there with me. You should see what I go through to deliver that baby for you. Because, you know, when that happens, it would change what they think of childbirth. It would open their eyes. It would show them just how big a deal it is to bring life into this world. So I really, really think men should be involved during childbirth, completely involved.
I accompanied my wife because when we decided to give birth to a baby, we attained together and come to this. Therefore, I saw that it is very vital to accompany her to the hospital since we are organizing to have a baby, and therefore we have to take care of it until we get the kid.
To reduce maternal mortality, all women must have access to maternal health services, including skilled attendance during childbirth. Investing in midwives will save lives, empower mothers to take control of their reproductive health, and enable women to positively contribute to their communities.
Our commitment is a long-term one, and we will certainly continue to support the health sector in Uganda, not the least through our development cooperation operations. What we hope to achieve with the Midwives4ll campaign is for the general public and policymakers to recognize the importance of midwives in society.
Investing in midwives will not only save lives of mothers and newborn babies, it will also lay the ground for individuals to plan for their families by enabling them to make informed choices. Midwives have a central function to empower men and women to make the right choices as regards their reproductive health and general well-being.